so if you know anybody else. Meeting of the Health Subcommittee is called to order. Today we're having a hearing on our collective battle against diabetes, the progress we've made so far, and the challenges that remain. Over 30 years ago, Congress passed the National Diabetes Research and Education Act, the first significant legislation directed at coordinating and expanding the government's research and prevention efforts related to diabetes. While we've made tremendous progress in understanding and treating diabetes, it remains a significant public health epidemic. It's staggering to realize that over 23 million Americans have some form of diabetes today, and the number is growing. Even more troubling is that 57 million Americans are at serious risk for developing type 2 diabetes, including women with gestational diabetes. Until recently, kids were rarely diagnosed with anything but type 1 diabetes, and the increasing rate of childhood obesity is changing the face of diabetes, though, and certainly not for the better. Now, as we'll hear today from our esteemed panels, diabetes is a leading cause of heart disease, stroke, blindness, and kidney failure. As is often the case, diabetes disproportionately affects racial and ethnic minorities. American Indians have the highest prevalence of diabetes, nearly 4 times those of white Americans, with Hispanics and African Americans close behind. Moreover, there's a clear economic cost. It's been estimated that over $220 billion in medical expenses in 2007 can be attributed to diabetes. And these are serious problems which need aggressive and innovative action. Today we're going to hear from 2 of our government witnesses from the National Institutes of Diabetes and Digestive and Kidney Diseases, located at NIH, and the Centers for Disease Control. Both will speak to their agency's role in doing landmark research and surveillance work related to diabetes and how this information has been translated into more effective prevention and treatment strategies, including the development of key therapies and technologies. I should add that NIDDK has recently celebrated its 60th anniversary conducting and supporting biomedical research to improve healthcare across the nation. NIDDK leads the nation's federal commitment in research, education, and health information dissemination with respect to diabetes and supports investigators who continue to make strides in research toward understanding, preventing, and treating type 1 diabetes, type 2 diabetes, and gestational diabetes. It's for these reasons that the ranking member, Congressman Shimkus, and I recently introduced a resolution honoring the NIDDK for its outstanding work. Now, on our second panel, comprised of leaders from the American Diabetes Association, the Juvenile Diabetes Research Foundation, and the National Indian Health Board, will also be able to shed light on the partnerships they have with government and in the community to maximize research translating to improve health outcomes. Lessons learned from innovative research, such as that funded by the Special Diabetes Program, have informed our efforts to address the epidemic today and will continue to do so in the future. I have to mention my home state and say that innovative, exciting, and collaborative work on diabetes research is taking place across the country in public-private partnerships, and I'm proud that New Jersey's life sciences industry continues to play a strong role in contributing to our ability to address the epidemic today, and will do so in the future. Before I turn it over to Mr. Shimkus, she is here. I wanted to mention that there were many members who asked for this hearing, but the most persistent one was certainly the gentlewoman from Colorado, Ms. DeGette. But I know that many members have asked that we have this hearing today. And also, my Native American friends have been asking that we have this for some time because of the high incidence of diabetes in American Indian populations. So, with that, I will turn it over to Mr. Shimkus.
Thank you, Mr. Chairman. I also want to recognize my colleague. That's on. The light's on. Can I get some help? Should I move?
Oh, it's not working?
No. You can't hear it.
You can move, but stay on this side.
What's going
Diana
on?
DeGette would like me to sit next to her, I know.
We have this debate all the time.
I hope it's working over there. Are they all out now?
We're being frozen out again.
Mine works, just the Republican side doesn't work.
We had to bring our own mics. No, I can do it. This one doesn't work. You're freezing out your own mic.
Well, sit here then. Go ahead. We'll switch.
Chairman's chair, I think that makes most sense.
Go ahead. I hope it works. How's that?
Don't let Mr. Waxman know about this, okay? Let me, and it's a great way to start. I do want to recognize Diana DeGette, also Ed Whitfield and Freddie Upton and Zach Space. And Diana is a rabid supporter and well known for her hard and diligent work. So there's a story we tell only to ourselves about our first term when we sat together way up front. They moved us, so they moved me. Let me just welcome folks here. And as a member of the very large diabetic caucus and diabetes caucus and the work and from the whole community to help educate us, to help educate really children and parents and that whole plethora. It's a success story. Obviously, we would like to have the final success, which would be, cure, and that's the research and that's disease management, and that's what we should be focusing on. We will continue to express concerns about spending and the debt because budgetarily it'll affect our ability to get money to research and development. If we continue to spend more and more money on interest on the debt, then the discretionary money in the accounts that we have to do NIH, to do CDC, to do all the things that we need to do gets limited. In fact, USA Today, in their article, the federal debt will represent 62% of the nation's economy by the end of this year, the highest percentage since just after World War II, and that's according to the CBO. So when we raise issues about the new health care law, when we raise issues about spending and dollars, we are putting ourselves in a bad position to really focus on the things we want to do and set priorities as interest payments will start consuming that. So as we make those cases, we do that with the best intention. And this hearing is a result of a letter that was sent by Diana and her colleagues. We have sent other letters on the law that we hope will be well received too, whether it's the CMS actuary or of concern now are high-risk pools, which were promised in the new health care law, which some states can't fully fund and operate, or the states that have turned it over to the federal government because they're not going to manage it themselves. We have no idea what we're going to do, and those are promises we made as a nation with the passage of the law and the signing by the president. So we have to figure out how we can keep our promises. So I have a lot more I would want to say, but I know time is short, and I'll yield back my time and thank the chairman for letting me use his big chair.
Everybody may have to use it. We'll see. Thanks. Who's next? Thank you, Mr. Shimkus. And next is the gentlewoman from Colorado, Ms. DeGette. You got to sit here too, I guess.
Thank you so much, Mr. Chairman, and thanks to Mr. Shimkus for his, I think, allegedly kind words. I really want to thank Mr. Space and Mr. Whitfield and Mr. Upton for requesting this hearing with me, and I also want to thank Mr. Green and all the rest of the members of this committee because we all share a collective commitment to addressing the issues of diabetes. The 250-member Congressional Diabetes Caucus is the largest caucus in Congress, and we strive hard to keep it that way. The reason is because diabetes is the fastest growing epidemic in this country, and it affects everybody, young and old. 24 million people have diabetes in this country. 57 million people, which is a quarter of all American adults, have prediabetes. So one of our tasks, as well as giving quality care and management to the people who already have one of the various forms of diabetes, is to try to get these other people back from the brink. And this is something that's difficult because most of those people don't even know that they are pre-diabetic. Have we made progress? Yes, we've made some. We know that effective patient self-management of an individual's own diabetes is arguably the most crucial part of an overall care regimen, and there's now a substantial body of evidence that diabetes self-management training is effective, but only if the patient has access to it. We also know that medical nutrition therapy can have a significant impact on preventing prediabetes from becoming full-blown diabetes. One issue that I've been increasingly concerned about, and I've talked to a lot of folks about this, is access to technology. Because as the mother of a 16-year-old with type 1 diabetes, I see the wonderful care advances that she has access to. But these advances are very, very expensive. She now has a continuous glucose monitor, and the sensors that she puts in once or twice a week each cost $80 before insurance. So I say to myself and the members of the Diabetes Caucus, how can we make those wonderful advances in care and technology available to every diabetic, not just those who are fortunate enough to have parents with good health care coverage? We also know that disparities in minority populations are too prevalent, but we haven't done enough research to figure out how to mitigate the disparities in prevention, access, and treatment for these populations. So we've made progress, but when the incidence of diabetes in the U.S. continues to rise unabated, it's clear that diabetes has become, as described in this week's Lancet, a public health humiliation for our nation. The Diabetes Caucus is unwaveringly committed to tackle these challenges that are still unmet and to remove this humiliation. We will continue to press forward on all of the priorities, including making our hard-fought efforts to include certified diabetes educators as Medicare providers, to classify podiatrists as physicians under Medicaid, and many, many other priorities. The caucus is going to host a briefing on July 12th to address the growing epidemic of pre-diabetes so we can start thinking about ways to pull those 57 million people back from the brink. From prediabetes to type 1 diabetes to type 2 to gestational diabetes and even malnutrition diabetes, this condition comes at us in different forms. But the urgency mandates that we continue to work tirelessly to tackle the issue. And Mr. Shimkus is right. It's a health issue and it's also a cost issue. Because if we don't start putting the research into this issue now, it's going to overwhelm our healthcare system as my two young girls become adults. So I want to thank the witnesses on both panels for coming today. This testimony really helps us set our course as we move forward the rest of this year and into the next year to set our policy as a caucus, but also as a health subcommittee. And with that, I yield back.
Thank you. Next is Ms. Blackburn. I don't think her mic works either, so we're going to bring her up here.
This is the
Yeah. Oh, we have one working mic, so we can just jump around over here. You're right. We're looking for two fast. Mr. Chairman, I do thank you for calling the hearing, and I want to welcome Mr. Buford Rolin, who is chairman of the Poarch Band of Creek Indians in the Nashville area, representative for the National Indian Health Board, and say a special welcome to him for coming in today, and to all of our witnesses. We thank you for attending. We thank you for the preparation that you put into the hearings as you come to us. Diabetes presents serious financial burdens and cost patients in Tennessee more than $3 billion in 2007. I had the pleasure of meeting the Gould family from Middle Tennessee last year during the JDRF fly-in. 4 of 8 children in their family suffer from type 1 diabetes. It is impossible to imagine the financial and emotional toll that this disease takes on each and every day for that family. With the 6th highest rate of diabetes in the nation, this is a very important issue to our state of Tennessee. According to the JDRF, over 10% of Tennessee's population is diabetic. In an annual obesity report released Monday by the Robert Wood Johnson Foundation, Tennessee was ranked the second most obese state in the country. A direct link between diabetes and obesity exists. We all are aware of that, and it appears that Tennessee is on their way to a diabetes epidemic. Due to the prevalence of this disease, the research, treatment, and prevention efforts are a significant focus for our Tennessee medical researchers. In fiscal year 09, NIH, and we thank you, granted over $17 million for research in Tennessee. The American Diabetes Association has 8 active research grants in the state. Mostly are focused on type 2 diabetes. Vanderbilt University Medical Center's Eskin Diabetes Clinic is in the midst of 10 clinical trials to develop treatments and learn more about the disease. And finally, in my district, we have 2 wonderful JDRF chapters. They are working actively to support those with type 1 diabetes, and the organization has given more than, get this, $55 million to Tennessee researchers. They are doing a great work. So for all of our agencies that are in the room, we thank you for the work that you are putting in. And these volunteers with associations are doing an incredible job in our state. So I join my colleagues in saying this is an area where we want to heighten awareness. We want to be more proficient in our education efforts, and we hope that we provide the proper support for the researchers who are trying to find a cure, a treatment, and disease management programs for this disease. I thank you, and I yield back.
Thank you, Ms. Blackburn. I'm told we're okay now with the mic, so we'll see. Next is our chairman, Mr. Waxman.
Thank you, Chairman Pallone, for convening today's hearing. The term diabetes describes a host of related health conditions that are familiar to us, and the facts are staggering. More than 20 million Americans have diabetes, almost 60 million more at risk for diabetes, leading cause of blindness and kidney failure. People with diabetes are at least twice as likely to die of heart disease or have a stroke, and diabetes is the 7th leading cause of death. It affects all age groups, both sexes, and every race and ethnicity. However, older Americans and certain racial and ethnic groups are several times more likely to have diabetes than others. That's why I'm glad that we are taking the opportunity to learn about landmark research accomplishments, ongoing efforts to translate what we know works into practice, and research questions we have yet to answer. Research has shown genetic causes, effective prevention for type 2 diabetes, and ways to delay and prevent complication. NIDDK, CDC, and other agencies within the department are working to ensure that our government has a coordinated effort to advance diabetes research and improve the health of those affected by this condition. Still, there is work to be done. We must continue our efforts to prevent women with gestational diabetes from developing type 2 diabetes later in life. We're not yet able to prevent type 1 diabetes, nor have we perfected the link between the continuous monitoring of blood glucose and the administration of insulin, the so-called artificial pancreas. And just this week, 2 new studies on the drug Avandia underscored the need to better understand and better treat type 2 diabetes. Underpinning all of this is the importance of a broad public health approach to this disease. We need sustained investments in research. We need people who have information to be emphasizing the point that diabetes is 24 hours, 7 days a week. That's why we support what the healthcare providers, families, and what is going on in workplaces to maximize each person's health and well-being. I want to thank the witnesses for appearing before us today, and I look forward to hearing their testimony. And with that, Mr. Chairman, I yield back my time.
Thank you, Chairman Waxman. Next is the gentleman from Georgia, Mr. Gingrey.
Thank you, Mr. Chairman. the World Health Organization has found that more than 150 million people suffer from diabetes, and it is estimated that this number will actually double by the year 2025. For at least the last 20 years, diabetes rates in North America have been increasing substantially, with about 18.2 million Americans living with the disease in 2002. Of those, roughly 90% have type 2 diabetes, which costs the United States as much as $132 billion a year. These statistics are a stark reminder of the impact the disease has on our nation, but also a reminder that the onset of diabetes for some Americans can be prevented. A majority of the patients with type 2 diabetes are obese, the connection being that chronic obesity leads to increased insulin resistance that can then develop into diabetes. Obesity in many forms is a gateway from which diabetes, heart disease, and other chronic conditions can strike American patients. Therefore, as we look at the federal response to diabetes, I would suggest that we also consider the root cause of obesity, reassessing the food stamp program so that healthy foods are encouraged, ensuring access to local parks and recreational programs, and promoting employer wellness programs, all are things that the federal government can and should do to encourage healthy lifestyles. We should also ensure that Americans with chronic diseases have access to quality health care. Unfortunately, President Obama's health care reform bill will make it hard for many Americans with chronic diseases to find care when in need. As many of you know, the pre-existing condition insurance plan passed as part of President Obama's health care bill, Patient Protection Affordable Care Act of 2010, will begin accepting applications in many states today. However, according to an AP article that ran just yesterday, and I quote, "Premiums will be a stretch for many, and the $5 billion that Congress allocated the program through 2013 could run out well before that," end quote. The Congressional Budget Office, in a report released last week, supported this finding when stating that the program's funding will not be sufficient to cover the cost of all applicants. Mr. Chairman, Ranking Member Shimkus has repeatedly called for hearings on the new health care law because it is deeply flawed and certainly can and I think will hurt our country. Since the day the bill was enacted, we have been reminded how this bill fails everyday Americans. Companies filing billion-dollar losses with the SEC, the Department of Labor reporting that half of all workers will actually lose the health plans that they have today, and many Americans with chronic illnesses will be offered health insurance that they just simply cannot afford. Mr. Chairman, I would urge this committee to act and hold hearings on the problems in the bill, President Obama's health care law. That being said, however, Mr. Chairman, I really do want to single out and commend Congresswoman DeGette for her efforts in addressing the incidence of diabetes in this country. She represents and is, I think, chairperson of the largest caucus in Congress today with over 250 members. Her leadership in this area is laudable and worthy of recognition by this committee and by myself, a practicing physician before I got this job. And with that, Mr. Chairman, I'll yield back.
Thank you, Mr. Gingrey. Next is our Chairman Emeritus, Mr. Dingell.
Mr. Chairman, I thank you for your courtesy and I commend you for this hearing. First, I wish to recognize the many members of this committee who have continued to beat the drum on this disease, and I thank them for their leadership. It is safe to say that we have a diabetes epidemic on our hands. More than 24 million Americans are afflicted with the disease. That's more than twice the number of people with diabetes in 1997. In my home state of Michigan, more than 680,000 people, 8.6% of our population, struggle with the disease daily. In addition to the major health complications caused by diabetes, the economic toll of the disease is considerable. Diabetes costs the U.S. economy $174 billion every year. 1/3 of every Medicare dollar is spent on people with diabetes, and already stretched state Medicaid programs are confronted with the growing costs of diabetes care. Since the passage of the National Diabetes Research and Education Act in 1974, the federal government has worked to coordinate diabetes activities amongst the various responsible agencies. most notably the work of the for Disease Control and Prevention and the National Institutes of Health have taught us a tremendous amount on the causes of this disease and ways to control and prevent it. Because of our surveillance, education, and treatment activities, individuals today with diabetes live longer and healthier lives than people who were diagnosed with the condition in prior decades. However, rate of new cases of diabetes continues to increase. As a result, the gains in control and treatment are being overtaken and submerged by the increase in the number of people acquiring the condition. The recently enacted health reform law will address the many abuses employed by insurance companies to discriminate against those with diabetes, and I am extremely proud of that fact. Additionally, the new law provides access to the necessary tools to manage and prevent diabetes and its complications, including the creation of a national diabetes prevention program, a national report card on diabetes to be updated every 2 years, and state grants to provide healthy lifestyle incentives for Medicare beneficiaries. Now, these steps will go a long way in our fight against diabetes, but more can and should be done. We must ensure our approach is consistent with current science and with understanding the disease. Our approach needs to be comprehensive, and it must ensure that all we do that we do all we can to prevent the onset of the disease, to ensure the diagnosis of the disease is conducted in the most efficient and accurate manner, and to ensure that our people have the best methods available to control the disease, and ensure that diabetics have the best treatments and medications available to prevent complications. The instrument that we make in defeating diabetes will have an enormous impact on the health of our nation. Thank you again, Mr. Chairman. I yield back the balance of my time.
Thank you, Chairman Dingell. Let me now say, they just called 3 suspension votes, but I'd like to take one more speaker and then we'll recess and come back, which should be about half an hour or so. And next on my list is the gentleman from Kentucky, Mr. Whitfield, and after you, we'll go vote.
Well, thank you very much, and I certainly want to thank the witnesses for being here today. We appreciate very much the commitment that you have made to help us find a cure for this disease and to reduce the number of people that unfortunately have it. And I also hope that those in the audience are not disillusioned that Republicans and Democrats are so joined together on this issue. And but I do want to thank Diane DeGette and Henry Waxman and Frank Pallone, as well as John Chimkus, Joe Barton, Fred Upton, Zach Space, and all of those who are involved in and interested in this issue. 2 months ago, I was down in my district and I met with the parents and 6 teenagers who all had diabetes. And we frequently, those of us who are laymen, think that what you eat and your weight is the determining factor of whether or not you have diabetes. But when you talk to these young teenagers, all of whom are very thin, very energetic, all of them have diabetes, and then you realize what they go through every single day with the testing that they do, with the monitoring that they do, watching the foods that they eat, the emergency runs to the hospital they make, and the impact that's going to have on their entire life. It does bring home very clearly the impact that this disease has. Other speakers have talked about the statistics and the cost and the impact on the number of people in our country. And so I think this hearing is very important. I certainly want to thank Diane DeGette for sort of leading the charge. I know that all of our physicians on this panel, Dr. Gingrey and our friend from Texas, Dr. Burgess, have a particular interest as well. So we look forward to your testimony to help guide us as we move forward. And I also want to point out that while the federal government is spending a lot of money on research, we also have some private companies that are spending a lot of money on research. And one that I would like to particularly mention is Novo Nordisk, which happens to be a company in Denmark but they have 4,000 employees in the U.S., and the federal government is the U.S. federal government is the only entity that's spending more money on research on diabetes than is Novo Nordisk. So I want to thank them and their leadership team for their commitment to this disease as well. Thank you, Mr. Chairman.
Thank you, Mr. Whitfield. We have time for one more before we break, so I'm going to ask our Vice Chair, Ms. Capps, to do an opening statement.
Thank you, Chairman Pallone, for holding this hearing, and it gives me an opportunity to thank my seatmate here, my colleague Diana DeGette as well, for bringing us all together around this issue, and on behalf of the entire diabetes community, because as I was just mentioning to her, this is a very well-organized group with juvenile diabetes and make visits to their members of Congress regularly, and I want to applaud them for doing that. It really has an impact on us. I look forward to an update today from our esteemed witnesses on the progress of diabetes research. After all, despite all the promising discoveries over the past several decades, there still is no cure, no surefire way to prevent the development of diabetes, especially type 1. As many of my colleagues know, I was a school nurse for many years, and if there's one disease that's sure to bring a student, a frequent visitor, into the nurse's office at school, it's diabetes. So I certainly became very familiar with the maintenance of type 1 diabetes, and I had been hopeful that by now we would have something in place, but there are many promising things on the horizon, which is exciting to know about what we're going to learn today. The sad truth, however, as my colleagues have indicated, is that children don't suffer today just from type 1 diabetes. There is such an increase now in the incidence of type 2 diabetes. I know there are definite steps to prevent the onset of type 2, and we can take in our communities, such as increased physical activity and better nutrition, but we need also to be creative in how we get the message out to at-risk populations, especially minority ones, and design programs targeted for those populations. I think particularly of programs in my district such as St. John's Latino Health Diabetes League, that initiative in Oxnard, California, which is tailored educational programming to at-risk communities. But they can only do this with the right type of evidence-based research being conducted at the institutions represented here today. So I'm especially curious today to learn more about how you're working to equip our local communities with the tools that they need to address diabetes prevention and management. I look forward to hearing from our witnesses about the exciting work you're doing now and on how Congress can better work with you and help you to achieve our shared goal of finding a cure. So I yield back. Thank you.
Thank you, Ms. Capps. So we'll now take a recess for the 3 votes. You're next. I don't think that'll work. The committee stands in recess.